Athlete's heart. Athlete's heart is also called as athletic heart syndrome or athletic bradycardia or exercise-induced cardiomegaly. Definition of athlete's heart. It is a non-pathological condition in which the heart is enlarged and the resting heart rate is lower than the normal, that is 40 to 60 beats per minute, whereas the normal heart rate is 60 to 100 beats per minute. In athlete's heart, there is increased work demand which results in increasing the heart mass and volume with training. The cardiac muscle, just like the skeletal muscle, undergoes hypertrophy as a result of chronic endurance training. Hypertrophy means increase in the size of the organ. Cardiac hypertrophy, which is induced by exercise, that is, increase in the size of the heart, which is caused because of exercise, is called as athlete's heart. However, this cardiac hypertrophy which occurs is now recognized as a normal adaptation to chronic exercise training. Most often, it does not have physical symptoms. However, they have consistently low heart rate, that is around 40 to 60 beats per minute. There are three signs involved in athlete's heart. The first one is bradycardia, that is decrease in the heart rate, that is 40 to 60 beats per minute. Cardiomegaly, that is enlarged heart, and cardiac hypertrophy, that is increase in the size of the heart due to thickening of the muscular walls of the heart. Apart from the first three signs, you also get S3 gallop, which is a low pitch sound heard early in diastole. Cause of athlete's heart is due to dynamic physical activity or aerobic training which occurs for more than 5 hours per week. Diagnosis is through incidental finding, echocardiography, electrocardiogram, and chest X-ray. Let's see the differences between athletic heart syndrome and cardiomegaly. The first parameter is left ventricular hypertrophy. In athletic heart syndrome, it is less than 13 mm. In cardiomegaly, it is more than 15 mm. The second one is left ventricular and diastolic diameter. In athletic heart syndrome, it is less than 60 mm. In cardiomegaly, it is more than 70 mm. Third is family history, which is not significant in athletic heart syndrome but may be present in cardiomegaly. The blood pressure response to exercise is normal in athletic heart syndrome, and the systolic BP might either be normal or reduced in cardiomegaly. Fifth parameter is deconditioning. Deconditioning refers to adapting to a less demanding environment as compared to the normally acquired conditioned environment. For example, when deconditioning occurs due to decreased physical activity, you get decrease in muscle mass or loss of muscle mass. So in athletic heart syndrome, there is left ventricular hypertrophy regression, and in cardiomegaly, there is no left ventricular hypertrophy regression.